The other thing I have to say is I just don't want you to think Sachs has lost his touch. I understand there is nothing intrinsically interesting about fat absorption. I get that, but you'll just see that it's all over the damn place, and it's just important to do, especially as it relates to the fat-soluble vitamins. And my goal when I do these things are to make them as reasonable as possible so they're just not like totally suck. So fat absorption / malabsorption is all over the place. You have to understand how fats are absorbed to understand the malabsorptive piece. And it's the malabsorptive piece. It's like the diseases that cause malabsorption. And again, the complications, it just crosses all kinds of organ systems. We'll get into vitamin deficiencies. We're covering the liver, the pancreas, the gut. It's just great stuff. All right, so here he is eating that delicious Reuben down in Florida at the golf shop. And he's got some fats in his gut, and that's where the story will begin. You know, what's the next step? The next step is this. The fat, they're going to leave the stomach and not interested in fat digestion in the stomach, but they're going to hit the duodenum, the small bowel, and the fats and proteins. It's actually mostly proteins, but nonetheless, fats in the small bowel are going to stimulate the release of cholecystokinin. Cholecystokinin secreted from the eye cells. So what does cholecystokinin do? It's going to stimulate the gallbladder to contract, relax the sphincter of Oddi, and next thing we have bile in the gut. So bile, what's the purpose of bile? Bile salts, it's to coat triglycerides, right? And what is that? That's a simple, it's called a simple mycel as opposed to a mixed mycel. That's a simple mycel. It's just bile, salts, and triglycerides. So that's part A of the story is bile. Part B of the story, cholecystokinin also stimulates the pancreatic acinar cells, right? That's another stimulant there. Not the secretory ductal cells, but the acinar cells, and they release lipase, phospholipase, cholesterol esterase, digesting all the fats in addition to other things secreted by the pancreas. So that's kind of next step. So simple mycel, not beating it to death. What's a mycel? Aggregate of molecules, fats in a colloidal solution. It's just to make the fats soluble. That's what the role of the bile salts are. And again, simple because it's a bile salt and triglyceride. Right? So now what happens? We already talked about colipase, phospholipase, cholesterol esterase, took that triglyceride, broke it down, and made monoglyceride-free fatty acids. So it broke that down, but also broke down cholesterol with the esterase, broke down phospholipids, and now we also have fat-soluble vitamins that have been freed from the foods we're eating. So now we have, that's a mixed mycel. So the bile salts are there. Now we have a mixed mycel. That's the difference between the two. But that's a delicious thing. We have digestion cooking here. And what happens is these mixed mycels get delivered to the surface of the enterocyte, and they're basically passively absorbed. Right? So now we're going to take up the story from the enterocyte. But before getting to the enterocyte, like, what happens to the bile guys? You know, where do these little fellas go? Right? They don't just disappear. Right? This is important. It's a key point. There's this enteropathic circulation. This matters. Enteropathic circulation matters. Recycling, the bile salts are done. They've delivered the mixed mycel to the enterocyte, and they head back, you know, downstream in the terminal ileum. Boy, that matters. Terminal ileum, they get reabsorbed after being deconjugated. So they get reabsorbed as these secondary bile acids through the portal circulation. They go back to the liver. Everybody's happy. They're recycled. It's an efficient process. What happens? Failure of this process, terminal ileum. If you have a disease of the terminal ileum, Crohn's disease or surgical resection, those are the two things they do to take out your terminal ileum. What happens? You're not recycling bile acids. You don't have bile acids now. You don't have bile acids, bile salts. You're not going to absorb fats. How is that going to present itself? It's going to present itself as steatorrhea. Steatorrhea, if you're going to have steatorrhea, you know that not far behind are the fat-soluble vitamin deficiencies, all because of enteropathic circulation of bile salts, right? And the need for the terminal ileum. And look at what I did here. And we're going to come back to this again, but I just said failure to reabsorb, right? That's a failure because we don't have a terminal ileum. What if they're deconjugated way upstream, right, in the state of bacterial overgrowth? You got bacteria way up north. They deconjugate the bile acids very aggressively in the proximal bowel, right, and they get reabsorbed there. So fat malabsorption in bacterial overgrowth. Now, I don't want to simplify because bacterial overgrowth, multifactorial, mucosal injury, carbohydrate malabsorption as well. But I'm only mentioning it because mechanistically, we said you cannot absorb bile acids because you lost your terminal ileum. But if you deconjugate them too much, too aggressively, they get reabsorbed early, and you can wind up with a similar syndrome. I think that's fascinating. And again, it's just this applied physiology, a way of thinking about these things. All right, so that's enteropathic circulation. So here we are, we have the enterocyte. We're picking up the story, right? We absorb fat soluble vitamins, monoglycerides, free fatty acids, cholesterol, phospholipids. Stupidly, and I think this happens just to complicate the life of medical students, the triglycerides were digested into monoglycerides, free fatty acids, then they go to the endoplasmic reticulum and are reconstituted as triglycerides. Does that make anybody's life easy here? No, it added an extra step to our life. The triglycerides are reconstituted, go to the Golgi with cholesterol, phospholipids in the form of these apolipoproteins, fat soluble vitamins in there, and we've just made a chylomicron, right? Chylomicrons are big, right? So they're trying to get out of the enterocyte, but they're too big to go in capillaries. So they go in these lacteals instead. And where does the lacteal go? They ultimately all coalesce and you wind up in the thoracic duct. So you're having lymphatic absorption. This is not portal circulation. So the first step is through the thoracic duct. Thoracic duct, we know, travels through the mediastinum, posterior mediastinum. That might matter, en route to the subclavian artery. And so the fats, they didn't go straight to the liver. They're in our circulation, subclavian artery. Now our fats are out in our circulation, just ripe for lipoprotein lipase, where they are further absorbed into the peripheral circulation and deposited right here, but around my waist. We either utilize them for energy or they get stored in the form of fat. Whatever doesn't get stored in the form of fat or utilized, that chylomicron remnant will ultimately finally make it back to the liver. I told you that thoracic duct travels through the posterior mediastinum, and what do they like to do with that? Again, applied anatomy. This is the issue of chylothorax. So that you stick a needle into the pleural space, you pull out this white milky material. What's the white milky material? Is it pus? No, it's triglycerides, right? And again, that's one derivative. So chylomicrons are chylothorax, and they're going to ask you the cause, right? Typically, most common is really surgical injury, but what's the other cause? Any tumor of the mediastinum. So bronchogenic carcinoma, lymphoma. So chylothorax, applied anatomy about the thoracic duct. The other issue we'll get to, of course, fibrates and their effect on lipoprotein lipase. The only reason I'm sticking it here is fibrates come up under the discussion of lipid-lowering drugs, right? But what lipid is it lowering? If it works on lipoprotein lipase, you know the target is triglycerides. It's really a triglyceride-lowering agent. It's not really a cholesterol-lowering agent. So we've already touched base on a lot of things. We talked about the liver making bile salts. We talked about pancreatic secretion. You need the pancreas, and you need enterocytes. So these are the key components in fat absorption, and we understand that.